Having diabetes basically doubles a person's risk for developing cardiovascular disease and makes it more likely they will develop these problems at an earlier age. In addition to the increased likelihood of cardiovascular disease, people with diabetes also tend to have heart attacks that are more serious and more often result in death.
Having high blood glucose levels is associated with a condition called atherosclerosis, which is the clogging and hardening of blood vessels. Elevated blood glucose levels may increase the buildup of fatty materials inside blood vessels, which is a key contributor to atherosclerosis, but it also may cause inflammation inside blood vessels, which can aggravate the condition.
Dr. Patel, can you tell us what other complications can result from diabetes-related atherosclerosis?
Sure thing, Dr. Hempstead. One of the major types of cardiovascular disease that's common in people with diabetes is coronary artery disease, or CAD. CAD is caused by the hardening or thickening of the walls of the blood vessels that go to the heart, which reduces the blood supply to the heart. When fatty deposits block the blood supply or reduce it too much, the result is a heart attack. Another major type of cardiovascular disease common in people with diabetes is cerebral vascular disease, which results from the narrowing, blocking, or hardening of the blood vessels that go to the brain. Cerebral vascular disease can eventually cause transient ischemic attacks, or TIAs, and strokes. TIAs are caused by a temporary blockage in a blood vessel to the brain, and strokes result from the blood supply to the brain being suddenly cut off. Strokes cause the death of brain cells, which may cause permanent problems with speech, vision, weakness, or paralysis. People with diabetes are also more likely to have heart failure, a chronic condition in which the heart is unable to pump blood effectively. High blood glucose may cause damage to the heart muscle and to the vessels going to and from the heart, which can lead to heart failure. Another cardiovascular condition often found in people with diabetes is peripheral artery disease, or PAD. A person with PAD has decreased blood flow to the legs and feet because the blood vessels in the legs become narrowed or blocked. PAD increases the risk for heart attack, stroke, and serious infection in the legs and feet, which can eventually lead to amputation.